Let me start with thanking the organizer, and this is a great meeting, looking at so many things in the last 2 days. This talk is a little bit different from MRI guidance versus coming back to the ultrasound guidance. So the system that I'm going to describe is called the Sonoblade, and that's been now used in the United States since last year, but it has been around for last over 15 years and has treated many, many patients outside the United States. The basic idea is to utilize a single element transducer that has both the capabilities of imaging as well as producing the HIFU beam. And so they are by nature co-aligned, and you are going to ablate the tissue what you are imaging. So it's imaging and therapeutic ultrasound is applied with the same transducer or the same probe. The imaging allows two-dimensional images both in a what I call the linear or the sagittal scan as well as the transverse scan, and they are always perpendicular to each other, so you can get the three-dimensional view of the prostate for therapy planning. So in this case, in the slide it's showing that the operator or the user plans the treatment utilizing both the transverse as well as the sagittal scan, and in a whole gland ablation, the entire prostate is being treated. So how do we monitor what's going on? So one of the goals is to quantify the tissue changes, not necessarily the temperature, but really are the tissue are changing as a function of treatment, and can we measure this using the pulse echo ultrasound? So there are many parameters, and one of the parameters what we have noticed that changes very quickly is called the tissue attenuation, which is the reflection of the sound as well as the scattering of the sound and the absorption. And what you notice is there is a very nice curve when the temperature starts going above the 50 degrees. It's continued to increase, and when it reaches around 70 degrees, it becomes irreversible. So we utilize the basic principles of tissue characterization. And when we measure the backscattered signal, this is what it looks like. In the box is the focal zone, which is about 40 millimeters away from the transducer. And you can see the backscattered signal change as we apply the HIFU energy as a function of time. So we can capture this information and do the analysis on that to find out how much of the backscattered signal has changed. There are multiple number of things that change that's being mentioned as well as published many, many times in the publications. But our primary goal is to look at the RF backscatter data and make the calculations in the frequency domain to find what we call the frequency-dependent attenuation. So I won't go through the algorithms, but these are well-described algorithms in tissue characterization textbooks. Here what we find is before the treatment and immediately post-treatment when we gather the RF backscatter data, the blue line is the frequency spectrum of the signals coming back from the untreated tissue, and the red line shows, which is a frequency spectrum of the treated tissue. So what we use is the same tissue as the control. Just prior to treatment, we get the RF backscatter data, and immediately after the HIFU shots, which is a 3 seconds long, we get the RF backscatter data, and we just compare them. And what you can see here is a significant change as a function of temperature in the RF backscattered signal. When the RF backscattered signal is shown here in the chicken tissue experiment, when the temperature is below like 40, 50 degrees, there's not much change in a backscattered signal. and the backscatter signal significantly increases when the temperature goes above 65 degrees. So this is how we characterize and we present that green, yellow, and orange after every shot so that it can be monitored the tissue changes. Again, here is the quantitative information about the amount of backscattered signal amplitude change as a function of temperature. We carried out the same experiment using a thermocouple which has a multiple elements to measure the temperature in the prostate in 5 patients. We get very similar results in backscattered signal as what we have received from the chicken tissue, except there is a slight band, and that's due to the heat conduction. And you can see the temperature reaches close to 90 degrees inside the prostate. Now, having this computerized model, the entire prostate then is demonstrated in 3 dimensions, and each voxel which was treated is painted. This gives a chance to the operator to go back and retreat the area if they found insufficient energy. For example, on one of the panels, the green color shows up. That was not treated properly because of the near field was causing the problems to get the energy at the focal spot. After a few minutes, when these bubbles disappear and was retreated, and you can see a bigger change in the backscattered signal. So this is how we do the monitoring and present the data to the user. And here is an example of the entire prostate being ablated and MRI done the follow-up week. So as you can see, very good survival as well as the effectiveness is achieved with the Sonoblade device using this algorithm. So in conclusion, RF backscattered signals can provide quantitative information necessary for improve the efficacy and treatment of prostate cancer HIFU. Thank you.
Thank you. That was a very interesting talk, and it's certainly a great goal to monitor treatment with ultrasound. I'm a little bit confused about one point. You showed the dependence of attenuation on temperature, and you showed that for temperatures beyond 50 degrees, the attenuation begins to increase. And then you showed
this one.
Yeah, that's it. And then you also showed that for the treated tissue, the backscatter went up, but I would expect the effect of increased attenuation to actually decrease the backscatter, because the backscatter is reduced by the attenuation coefficient.
This curve, what we see here, is a transmission curve rather than a pulse reflection curve. So this particular curve shows as a total effect rather than a just reflected signal back.
But it's the attenuation coefficient, and the backscattered signal you measure is reduced by the attenuation within the scattering volume.
But the backscatter increases here because it's not transmitting through the medium because its attenuation has increased, total attenuation. So the way we are defining attenuation is the summation of all the effects.
Okay, thanks.
I had a question with regarding the zone of damage that you showed. Have you done any correlation analysis between ultrasound predicted zone of damage to the MRI map zone of damage? How close are they?
No, we have not done that. We are taking MRI only after the ablation is done.